Hi guys, it's Eslyn and thanks for tuning in. I decided that weekly I'm going to drop new content. So every Wednesday at 8 a.m. Eastern time, you guys can check me out. I'll be dropping anything from pregnancy, PCOS. I'll be updating you with what's going on with me. So I'll have new topics weekly. So don't forget to check me out every Wednesday at 8 a.m. Eastern time. So make sure you subscribe down below so that you guys can see my weekly new content. All right, so today I'm going to be talking about uterine septums. If you saw my last video, you know that I experienced a miscarriage. It is my second miscarriage, so I'm looking at recurrent miscarriages. I was 6 weeks pregnant and my GYN did an ultrasound to rule out that it wasn't an ectopic pregnancy. Which it wasn't, thank God. It wasn't ectopic, but she also didn't see anything in my uterus because I was just way too small. It was only, like I said, 6 weeks. So nothing will really show. My HCG levels were really low as well. So nothing will show on an ultrasound. But when she was looking at my ultrasound, she said that she might have seen a uterus anomaly. My GYN sent me for an MRI. She wanted to get better images of my uterus to see if I do have a uterine anomaly. Now, there's many different anomalies. However, she thinks that I have a septate uterus. So if you're not familiar, a septate uterus is, it's a normal, completely normal uterus. The shape of your uterus is completely normal. However, you have a septum coming down the middle of your uterus, which is tissue. That's not supposed to be there. So it's a tissue coming down your uterus. And what's happening, this is why she thinks I have this. So what's happening is that once your egg is fertilized and is traveling into your uterus, it's attaching onto your septum, the wall of tissue, and it's not getting any blood supply. So it's cutting off the placenta from blood supply that it usually gets from your uterine wall. So instead of attaching to your normal, your uterus, it's attaching to the tissue in between your uterus. So it's not allowing it's basically cutting off your baby from any blood supply, and which is the reason why you're getting recurrent miscarriages. So my doctor thinks that that's what's going on with me, and that's why I'm experiencing recurrent miscarriages. And there is a surgery. It's a really small surgery. They go in with a camera and they just cut out the extra, the tissue that you have in the middle of your uterus. They cut it out, and then you're fine. Your baby's no longer attaching in the wrong place onto this tissue, and it can now successfully attach to your uterine wall. So fast forward, I got my MRI results, and my doctor confirmed that I do not have a septate uterus. She said my uterus is completely normal, and the images looked fine, and that everything looks good. She did say, however, that I have an arcuate uterus, but that an arcuate uterus is considered a completely normal uterus. So there's nothing wrong. I don't need surgery. Arcuate uteruses are not, there's no link to recurrent miscarriages at all. Now, to be honest, I don't know, I don't know if anyone else has felt like this, but I was kind of like a little disappointed. I don't know if this makes any sense, but I just kind of wanted an answer. And it's great knowing that I have a normal uterus. Don't get me wrong. I'm grateful for it. But it kind of left me in limbo. So like, I still have the big question mark of why am I experiencing recurrent miscarriages? So if I had a septum, it kind of would have explained, like, this is what's going on. Like your egg isn't attaching to your uterine wall. it's attaching to the septum, to this tissue. So this is what's going on. This is why you're having recurrent miscarriages. Let's just do this quick surgery and you know, cut it off and you'll be fine. Everything's gonna be great after the surgery. But that's just it kind of just like would answer like this big question that I have. So I don't know, but that's just how I felt about it, to be honest, like to be completely honest with you. But since I don't have that, I don't know what's going on. I don't know why I'm having these recurrent miscarriages. I do have an appointment with my reproductive endocrinologist coming up, and I'm going to do a bunch of tests. So I will definitely get information, hopefully get some answers to see what's going on. But as of now, I still do not know. To go back to my arcuate uterus, so if you're not familiar, what an arcuate uterus is, like I said, it's a completely normal uterus, but the top has like a slight like bend. So, okay, so picture a normal uterus. The top of a normal uterus has like this bend on top like this. And I guess to be considered an arcuate uterus, it has like a slight dip here instead of going up like this. So, and I did see my MRI pictures, and when I looked at it, it did go down a little bit, just a little bit, nothing like major, just like slightly like this, and then the rest of my uterus is, you know, just like normal, goes down. But however, like I said, it is considered a completely normal uterus. And there's no link to miscarriage or anything like that. So that's good news. Like I said, there's many different uterine anomalies that are linked to miscarriages and things like that. Like I know there's like a heart-shaped uterus. You know, it looks kind of similar to a septum, but it is different because of the shape of it on top. But yeah, so that's kind of where I'm at. So as far as my last pregnancy that lasted till 6 weeks, I started taking a baby aspirin at 5 weeks. They say that you should take baby aspirin in the beginning before you're even pregnant. But I didn't know any of that, so I took it pretty late. But next time going forward, I will be on a baby aspirin before. So I'm still taking it. I'm going to continue to take it. And my miscarriage, I bled maybe about 6 days. It was pretty heavy and painful. The first 2 days were pretty painful. Just, you know, took some Advil and yeah, and I was home, thank God. So I didn't have to you know, deal with anything else. So my plan is, like I said, I have this reproductive endocrinologist appointment coming up, so I'm excited about that because I need answers, and I can't wait to talk to my doctor. So I have that coming up very soon. I will keep you guys posted on my first endocrinologist appointment with my fertility center. My first experience with that, I will update you guys. And also I don't plan on stopping. I know a lot of women take breaks after a miscarriage. I personally am going to just continue the journey, and we're going to continue trying to conceive. I think that is a personal choice. So if you need a mental break, because it is much needed, it is very much needed, mentally you have to take a break, because you know, nothing is worse than adding, this process is stressful already, but you know, like, it really affects the whole fertility process. So please take a break. Don't try to fight through it if you just really mentally can't. I'm hoping that, like I said, with my appointment coming up and I'll do some testing, and I'll hopefully get some answers or see what they recommend. So I will have a lot more updates coming up soon. I'm also planning to do a video on all the supplements that I take, you know, all the vitamins and things like that I take, and what is ideal for fertility and what is working for me. So keep you guys posted on that too. Like I said, don't forget, I will be posting weekly videos. So every single Wednesday at 8 a.m. you should expect to see a video from me. That'll be weekly. So I can't wait to fill you guys in with my journey and welcome you in. Make sure you subscribe down below so that you can check that out. See you guys in my next video. And again, always, thank you so much for watching and your support. I really appreciate it. Bye.